Hi, Grandma. I heard you had some questions about diarrhea and how it relates to our health. I remember your first question you asked me was to estimate the number of people that die every day from diarrhea, and that's actually 11%. So 1 to 9 people will die daily from diarrhea. Identify the dangerous bacilli that often colonizes the intestinal tract after use of antibiotics, and there's actually two. One of them is Clostridium difficile, and the other one is Klebsiella oxytosa. I'm not sure if I pronounced them correctly, but you get the name is pretty intimidating, and just kind of speaks to how dramatic the after effects are after experiencing a bout of diarrhea and using antibiotics. Diarrhea kills more than AIDS, malaria, and measles combined. This is actually true. So diarrhea kills 11%, whereas AIDS, measles, and malaria total 10%. Estimate the number or the percent of deaths by diarrhea caused by malnutrition. This is actually 60% of deaths are related to diarrhea and caused by malnutrition. Identify the 3 rules of home treatment for diarrhea. So that's going to be making sure that there's an age-appropriate diet in place, giving more fluids on a PRN basis, and also knowing when to go back to the hospital and really seek intense medical attention. Explain what you should do if a child vomits during rehydration from diarrhea. So actually the mom should wait about 10 minutes and then resume ORS more slowly, and that would be about a spoonful every 2 to 3 minutes. The World Health Organization does not recommend snacks for kids. This is actually false. They actually recommend up to 2 snacks per day in addition to 3, balanced meals. And then a skin pinch goes back slowly. 2 seconds is a sign of severe hydration. So when we pinch our skin here, we see the skin turgor with good dehydration. It's actually pretty resilient, and in the event that there's extreme dehydration in place, it'll take about 2 seconds to kind of fully reset. So that's one of those signs of dehydration. It's a really easy test to perform. The rotavirus produces a toxin that causes diarrhea. This is actually true. And then as far as washing our produce of E. coli, you can wash off E. coli from fruits and vegetables, but you really have to do a very thorough job. And so that's really important to scrub your fruits and vegetables when you bring them home from the store, because people are touching them, they're sifting through the fruit, and we don't know the other germs that are already on the basket, and so it's just always really important that anything you bring home from the grocery store, not to consume it before you've had a chance to really thoroughly wash it with just some soap and water. Identify the leading cause of diarrhea in the developing world. That's going to be actually ETEC, which is enterotoxigenic E. coli. So that's what ETEC stands for. And identify what type of bacteria O157H7 is. That's better known as E. coli. And identify how many people Shigella kills in relation to other common infectious diseases. So that's going to be around 70%. So, which is really 1 million a year, and most of those cases are actually children under the age of 5. And then Shigella can actually continue on in feces for up to 4 weeks after the illness. So that's why it's always really important to exercise good hygiene. That's the best way to help prevent, coming down with a bad intestinal distress caused by bacteria that could easily be resolved by just being aware of, putting our fingers in our mouth and just being more cleanly, just in our daily lifestyle, making it a point to wash our hands on a pretty continual basis, because there's germs everywhere. So I hope you learned a little something, Grandma, and I'll see you next week. Thank you.